All right, good morning again. Welcome to the Multidisciplinary Advocates and Researchers Group meeting. My name is Sherayla Haynes. I'm the Community Partners Project Manager here at Frontiers. While we are housed at University of Kansas Medical Center, our partner institutions include KCU, UMKC, St. Luke's, Children's Mercy, K-State, KU Lawrence, KU Salina, KU Wichita, and I think I hit everyone. Um, I'm so excited today because we have guest speakers from the University of New Mexico that are here to talk to us. I am going to read a couple bios and then I'll share my screen and advance their slides for them. And if you have any questions, feel free to put them in the chat. Actually, Heidi, Cynthia, do you prefer questions in the middle of your presentation or would you prefer to wait until the end? Uh-oh. If you're talking, I can't hear you.
Can you hear me now?
Yes, I can. You do sound kind of faint though,
Okay.
Heidi.
Okay. Let me just change my mic.
You sound good now. I can hear
Okay.
it. The volume sounds good.
Great. I'm good either way with questions. I'm just not very good at seeing chat while I'm presenting.
Okay.
But I'm pretty casual.
Okay.
Cynthia?
I can't hear you at all, Cynthia.
Can you hear me now?
Yes.
Seems
Um,
I'm more used to Zoom, but you can hear me now?
it kind of goes in and out, but yes, I can hear you.
Okay. So I'm same with Heidi. If there's questions in the chat, I'm okay with you interrupting me and letting me know, but I'm not a good multitasker. So if someone could keep an eye on the chat and just let me know or unmute yourself. I love when people engage with me. So please do so.
Okay, so you heard it here live. Unmute yourself if you have a question and feel free to interrupt instead of waiting until the end. I know some presenters prefer to wait. So thank you for letting me know. So Heidi Rishell Brakey holds a master's in rehabilitation counseling, a bachelor's in psychology, and is the senior qualitative research scientist at the University of New Mexico Southwest Center for Clinical and Translational Innovation. She is passionate about and specializes in qualitative and community engaged research with 15 years of experience on over 80 mixed studies. Mixed method studies in numerous settings and health science disciplines, including public health, family and community medicine, psychology, obstetrics and gynecology, palliative medicine, cancer, education, pediatrics, and nursing. She is an in vivo certified expert, has authored 33 peer-reviewed publications, and created and facilitates the Southwest CACTI, that's what they call the Center for Clinical and Translational Innovation, qualitative research network to share her passion and experience with others. Cynthia Killough is the Senior Community Engagement Liaison with the University of New Mexico Health Sciences Center, CACTI. Through her work, Ms. Killough strives to increase the number of underrepresented populations in health research with a focus on New Mexico populations. She is from Las Cruces. Did I say that correctly?
Las Cruces.
Okay, Las Cruces, New Mexico, has a master's in psychology and is currently pursuing a PhD in health communication. Okay, I am so excited to hear a presentation about plain language and research dissemination, importance and practical insights. And now I'm going to share my screen to make sure. That's the wrong screen, isn't it? Let's move it over.
Well, while you're pulling that up, I can start. First of all, hello. Thank you for having me, having us. Very excited to be here. I am a
Jayhawk by heart. I I have a lot of family in Kansas, so there was a lot of rock chalk in the houses every time I went to visit. Also, I apologize. I am extremely casual. It is 7:15 here in Washington State where I am. I'm visiting my parents, and I didn't think to pack any not casual clothes. And Cynthia is standing in solidarity with me and also being casual. Thank you, Cynthia. But no, we're casual. So like we said earlier, please interrupt
No
if you have
problem.
any questions. And so go ahead and advance the slide. I guess my bio is a little out of date. I am the senior research scientist at our center. And as Sharayla said, I specialize in community engaged and qualitative research. And our team contracts with a lot of different investigators across health sciences. And so we've been on just about any kind of study that you can think about, or any topic you can think about if it's related to health sciences. So it's just really cool to be a part of so many projects and learn so much and work with so many people. And I'm very passionate about what I do, and even at a very small scale, I love that we can make a difference in people's lives. And one way is just sharing the information that we have and the projects that we have. And we are going to go into some specific tips for community-facing dissemination materials, and then Cynthia will show you some examples of what we and our teams have done. And just a disclaimer that we're not design or communication experts, although Cynthia will be a health communication expert very soon when she gets her PhD. But we've taken a lot of classes, read lots of information online, and we get feedback from the folks that we work with as we create and share materials. I usually find things that I should have done differently when I go back through my materials, and that's okay. Most of us aren't design or communications experts. This is a learning process for all of us. I just wanted to throw that out there. So don't worry about being perfect. What really matters is that we're trying and that we continue to try and we continue to improve. So the more you write and disseminate in plain language, and the more you get feedback from types of people you're trying to reach, the better your materials will get. That's just a little introduction for me and the presentation today, but I also, Cynthia, I'll let you introduce yourself and then I'll get back into my slides.
Thanks, Heidi. And thank you, Sharayla, for being our slide advancer for us, since, again, I'm not a good multitasker. But hello again. I am the Senior Community Engagement Liaison here with our Southwest CACTI. Our grant just got renewed for 7 years. It was a little dicey at the beginning. I think we were a little sweaty, but we're really excited that it did come through. And with that came expansion. And so considering where I started 6 years ago with our CTSA, we didn't have any community engagement liaisons. I was the first one, and now we are expanding. So I am now the senior program manager also for our community engagement team through our new grant. And I'm helping our community engagement program grow. So we're expanding. We have 2 more people now that are joining our team, which is really exciting. And then we're also helping the University of Arizona because they are part of our partners now. Sharayla, you have an extended network there in Kansas and around Kansas. I'm a bit jealous, but for now, UNM and U of A, that's our little network at the moment. So we're excited for that. So thank you.
Thanks, Cynthia. And just a little bit of logistical stuff. I always like to know how other CTSAs work. So we actually have 2 community engagement teams, essentially. Cynthia leads one, I lead the other. Cynthia leads full-blown community engagement. That's all they do. And then my team is more on the research side. We contract with investigators and we do community engagement, qualitative research, and soup to nuts from designing a project to dissemination and everything in between. So, Sharayla, go ahead and advance to the next slide. Thank you. Okay, so Just a really quick example of why plain language is important. I was involved in a study called COMPASS that screened for and provided health education about chronic kidney disease. This is a citation for the preprint, and I think we're in the last stages of getting it published, so hopefully it'll be out real soon, peer-reviewed. So COMPASS was a longitudinal, epidemiological, community-based, mixed method study that took place in a rural New Mexico community, with most participants being Native American or Hispanic. As part of this longitudinal project, patients received a kidney lab results letter using the National Kidney Foundation visualization tools like this one you see. We also sent a follow-up letter with incidental lab results needing attention. A year later, we conducted qualitative interviews, and that's where I came in. And these revealed that people were excited to take part in health research as a way to help their community. They found value in a study focusing on kidney health, and many made positive improvements in their lifestyle. They were very interested in learning more about kidney health generally, their own kidney health, and results of the study. But you can go ahead and hit next. There we go. As you can see here, there are many words, terms, or even sentence structure that are not plain language. I'm sure none of us would give this information to our family or friends in this way verbally. And these are the letters that we provided to folks to teach them about hypertension, diabetes, and chronic kidney disease. And I have a few examples of what people said in interviews about this education that they received. And just a reminder, this letter is the education. They didn't actually get to talk to anybody about it. They were just referred to talk to their providers if they had other questions. So a few quotes. Interviewer said, "What was your understanding of hypertension before the study?" Participant, "I don't know. Hypertension would be like you're very hyper and stuff like that. You get nervous, all that stuff." Interviewer, "After receiving the results letter, what's your understanding now?" Participant, "How do I understand it?" Interviewer, "Yeah, I'm just trying to ask about your understanding, how it might have changed before and after the study." Participant, "Yeah, it would change. I would understand more about what it's about, how to go about it and everything, how to help myself. Somebody like that can work with me or something." So clearly, she didn't understand what hypertension is, and we think that we helped her at all understand better with the letter or the study. One other person said this letter was like a scare tactic because it scared the crap out of me. I thought I had kidney disease. In fact, the letter said that they were at risk and should take action so they wouldn't develop kidney disease. And finally, one other person said, "I didn't understand it until my kidney started failing and all that. But disease? I don't have no disease, other than just the idea that I don't know why my kidney shut down." So in this example, the participant likely did have chronic kidney disease, but maybe had a different understanding of what disease meant. Next slide. So clearly, plain language is important. Patients want the results. They want the education, but they may have difficulty understanding. And we as researchers need to be mindful of health literacy and providing information to everybody in ways that they can understand. And I like this quote from Ho Loringer. "Your audience wants easy to read content that allows them to get the gist of the message efficiently. No one has ever complained that a text was too easy to understand." Next slide. So now to the how. Use these questions to guide your materials and answer to the best ability, and involve the people that you work with, involve the community, involve your audience to help answer these questions. So what is the purpose of the material? Are you just trying to give back to your participants, sharing the information with them? Is this just general information to the general public? Are you trying to educate them? Is this a call to action? Who is your audience? Consider their age, location, education, language, culture, experience, and background. And regarding education, even experts want plain language. It's not just English and Spanish. There's so many nuances with each language, the terms you use, the slang, etc. And regarding experts, the Nielsen-Norman group conducted a usability study with experts in science, technology, and medical fields and learned that even highly educated online readers crave succinct information that is easy to skim, just like everybody else. And then on to this next box. What are the needs and preferences of your audience? And these latter two boxes are related to who they are and just the previous responses. What does your audience already know? What would they want to know? And then finally, where and how will this be distributed and accessed? Do you want printouts? Do you want a website? Do you want instant messaging, audio, social media, and so many other ways that we can distribute information? Next slide. And here's some more tips. And I strongly recommend using dissemination in your peer-reviewed articles. Like I said earlier, even experts can take in what they read better. And there's research that shows that everybody just understands plain language better. So prioritize your information that must be included. You don't need to go into great detail about a lot of stuff. What's the gist? The who, what, when, where, why? And then you also need to address different audiences separately. Make it easy to read and comprehend. Obviously, plain language is a big point, but for you to know acronyms, that's a huge pet peeve of mine in peer-reviewed journals or every academic writing, or most academic writing, is we are obsessed with acronyms. I'll talk a little bit more about that in a bit. But use active voice, get to the point, use positive language. Positive language is just switching the way you write something. So for example, when you're going to meet a friend at the airport, do you say, if you fail to arrive by 5 o'clock, I cannot pick you up? That's not positive language. So you instead say, you have to arrive by 5 if you want me to pick you up. And then also just getting to the point. Make it conversational, again, depending on the audience, of course. Organize, put the important stuff first, and then the background information, the stuff that people don't care as much about, but might care about toward the end, if necessary. Be consistent with your terms. So if you're talking about healthcare providers, clinicians, don't switch with a bunch of different terms. Don't say physician in one spot, doctor in another spot, clinician in another spot, and then provider later. Make it visually appealing and skimmable. And Cynthia has some great examples she'll show you. But using colors, pictures, headers, bullets, text boxes, bolding the key text makes it really easy to skim to, and short sentences. And then, like I said before, of course, get feedback from your audience and your peers. Next slide. And here's just a few examples of things that many academic writers say and what you can say instead. Another pet peeve I have is utilize. I hate the word utilize. It's overutilized. Just say use, make it simple. Some other examples in here. Again, this also helps with word count. So instead of saying due to the fact that, just say due to, or in an effort to, say to. And references through all of this stuff. And Sharayla, I'm more than happy to share. We're happy to share all of these slides with everybody, including the notes. It doesn't matter. Whatever is most useful. Next slide. Like I said, I hate acronyms. And you can still get to the point, make it easier to digest for the reader, for someone who's unfamiliar with acronyms, and not go crazy with word count. So here are some examples. Instead of saying Engineering Safety Advisory Committee, don't put the acronym. You can just say the committee. Of course, you introduce it at the beginning. From here on out, we're going to call it the committee. Wearable activity trackers. This was a paper I was on. I really thought to get rid of the acronym, but I didn't win. So we said watts. I'm like, what's a watt? You have to just keep reminding yourself every time you see that. What is a watt? Instead, we could have just said trackers. And the Act instead of Fire and Police Employee Relations Act. Of course, if acronyms are more, example like US or PhD, ATM, FBI, people are more familiar with acronyms than they are the words. So in that case, we would use the acronyms. And then if you do need to use acronyms, of course, try to limit the number for the entire document, like for the peer review paper. Try for 2 or 3 acronyms. And then a key at the beginning of the paper is also helpful so they can quickly run back and see what it means. So for active voice, this is another one that style guides prefer. Some of them require active voice, but I still see a lot of passive voice, which makes it more difficult for the reader to digest. So in an active sentence, the person or the agency that is acting is the subject. In a passive sentence, the person or item that is acted upon is the sentence. So in passive sentences, they don't often identify who's performing the action. So here are a couple examples. Instead of saying the data was analyzed, we analyzed the data. Most style guides also encourage the use of first person, but I still, people really try not to use first person, and then that makes it a lot harder to write in active voice. Next slide. Let's get to the point. I like this example here. So instead of saying, there's no escaping the fact that is considered very important to note that a number of various available applicable studies ipso facto have generally identified the fact that additional appropriate nocturnal employment could usually keep juvenile adolescents off thoroughfares during the night hours, including but not limited to the time prior to midnight on weeknights and or 2 a.m. on weekends. Instead, just say more night jobs would keep youths off the street. There's so many ways that we can simplify it. Simplify what we're trying to say in length, and then the language we use, and using plain language. Okay, I'm going to turn it over to Cynthia now, and we'll give examples of some of the dissemination she's done.
Okay, and just a heads up, Sharayla, there's animations, so I'm going to say next, so you can hit the next animation so it can come in. Thank you. All right, so now we have a lot of examples to show you from projects and studies that we collaborated with. The first being that we conducted, this was probably about 2 years ago, we did community engagement studios with different counties around our state and created an infographic to disseminate back to our community experts who took part in the studio, their communities, and our own academic community. And as Heidi said, experts still like value and really understand plain language as well. So it was a very broad audience, but that was on purpose. All right, so next. Okay, so first on our infographic that we created, you can see we used plain language. Instead of saying community engagement studios about, and then like our long topic, we just said community conversations about health research. Next. We also used banners and colors to separate chunks of text. Next. And as you look at the front and the back pages of our infographic, we have these skimmable headings everywhere. Next slide, please. And so if you see, we started off with our background, so folks knew what we were doing. Next. We also had who we are and what we did, so who took part in these conversations and the goal. And then next. And then we also had who we talked to. So this is our state broken up, and we're talking to different counties, so that's who we included on who we talked to. Next slide, please. So we have, and this would be like the results section, but because this isn't considered research, these are more like just the summarizable highlights from our studios. So we have bullets that are short sentences to get to the point. Next. And we also have pictures. Please note that we use these sparingly and appropriately. So we wanted to make sure that we're capturing what we're saying, but not overdoing it. Next. And then we tried, this was really hard. So we did 4 studios and we're trying to condense it to a 1-page infographic. So we were trying to keep it brief. 2 pages was our limit. And even that was so hard, but we did it. So I'm really proud of ourselves. Next slide, please. So on the back, we have highlights from our studios, which include recommendations from community members on things that strengthen and barriers to community engagement, which is what our studio was about. And then we also had recommendations from researchers. This was things that our community members wanted us, the researchers, to know. And I was able to do a presentation and bring this back to our UNM leadership, including like our vice president for research and some of our IRB folks. So I made sure that they knew this is what our communities around the state were saying. Next slide, please. All right, so who better to create plain language materials than communities themselves? So in the state of New Mexico, we have community councils in each county centered around local health. And we assisted a New Mexico Health Council with a community engagement studio on mental health. They took the lead on creating their infographic from their studio, and I only assisted very minimally. They created their infographic using Canva. Again, they didn't consider themselves design experts by any means, but these days with platforms like Canva, anyone can create amazing materials. They took on the design. I only assisted with like getting like grammar correct or just double checking to make sure that things made sense to me to help them out. But I was really impressed with their ability to condense their studio highlights to 1 page. And again, this was all them. So I was just so proud of them for taking this on and doing this. This was their first time. They were new to community engagement studios, but this is the product that they designed and came out with. So I was really proud of them. Next slide, please. Okay. So our community engagement research team assisted in a project called Weave New Mexico during COVID, where they created content using mixed media, which they called Catalyst films, and digital stories to share stories from clinicians and their staff facing vaccine inequities in New Mexico during COVID. These were really great in that it shared real life stories from people on the front lines during this time. And they were really looking at Indigenous, Latinx, and Black communities around our state and sharing these online. So that was another form of just getting this information into video, audio, text, and then doing these digital stories to share with communities and providers around our state. Next slide, please. Okay, so in New Mexico, we still have a lot of rural and frontier areas who still really value postcards. And so one of the projects that we were helping with was an echo mat, so medicated assisted treatment. And this project wasn't even done yet, but we took a snippet from the data that we had collected at that moment to share with communities at that point. And so as you can see on a postcard, you can't put a lot of information on there. So we just put as minimal as we could. We tried to make it look engaging and fun. And then we also provided a QR code. So if they wanted to read more, find out more, follow the study throughout until it was done, they could do so. We also, down south near the border of Texas and Mexico, we have community health workers who are specifically Spanish speaking and serve Spanish speaking populations called Promotoras de Salud. And so we created another infographic similar to the studios that I showed you previously. And we had someone help us translate these professionally into Spanish. And then we look them over again, those of us who speak Spanish on our research team. And then we disseminated these back to our promotoras de salud. Again, we're not like design experts at all, but as you can see with Canva, it makes it really easy for us to share results and disseminate data in a really pretty and engaging way. Next slide, please. So looking ahead and using resources we already have, this year we started a community engagement newsletter that we send out quarterly, and we're planning on using this platform to disseminate results of studies and projects that we've been a part of. Keeping in mind that content on newsletter balances information and relational content. So not just updates, but also stories and highlights that foster connection. And again, keeping all of those nice recommendations that Heidi shared at the beginning, like keeping all of those in mind and just helping us keep plain language at the center of what we're doing to share this information with our communities. Next slide, and I'll hand it back to Heidi.
Okay, just wrapping up. I have lots of resources to share. Like Cynthia said, we use Canva all the time. Again, not a design expert, but Canva makes it super easy. They have lots of great templates, and we do have the professional version and access to everything else, and it's reasonably priced. I don't, Cynthia, do you know it's like $100 a year or something?
Yeah, and the license usually lets us add up to like 5 other people on a license, which is really nice. And it was something that our work was like, we will pay for you because we use it so much and so frequently that they help us with that.
But even the free version is great. You don't have like as many templates or pictures or fonts or all that, but there's still so much you can do with the free version. I really like all of these references for plain language, plainlanguage.gov, Center for Plain Language, CDC, AI chatbots can be really helpful. And then this in group, I referenced a lot of their research, their studies that they've done just on plain language and communication. And there's a good link for preferred terms for population groups. Of course, I hope all these government websites stick around, so keep that in mind if you don't find them. There's some good resources for communicating science and health research, or CDC, Alan Alda's Center for Communicating Science is amazing too. Next slide. Some health literacy stuff. Oh, I guess that should have been on the last slide. Communicating science, health research generally. Yeah, it was on that last slide. Graphic design. We mentioned Canva. There's some good sites, design principles, and infographics in addition to Canva that just give you some information about what makes a good infographic, what makes good design. And then there's tons of stock photos you can find all over the place, but I like Upsplash and Pixabay. Next slide. That's it. You can stop sharing and we can see people's faces and talk and answer any questions that folks have.
I have a question. First of all, let me just thank both of you so much for doing this, and Heidi being at home with your family and taking the time to work with us is amazing, above and beyond. So thank you so much. So I really love what you're doing, and I think it's so important. And as academics, we are always struggling with how we can make our research relevant to the communities that it should matter to. And many times they don't even know what we're doing if we're not in partnership. But in terms of the communication tools that you're providing us, which is amazing, I do have to think about folks, as you had said earlier, that you are not trained in communication, although Cynthia, you will be. Have you considered partnering with folks in other departments, social sciences, humanities, language? Have you worked with your faculty and students simply because, you know, you have this amazing digital storytelling project during COVID with Native communities? How well was this technical video work made? Who did you work with on it? I'm really interested in the interdisciplinary ways that we can bring our strengths to make things great, because sometimes artists, of course, want to do their own work, but they want to support your work too, and you can work with them as well. So I would love to hear more. Thank you.
Cynthia, do you want to start with your pieces and I can talk about the things I've been involved in?
Yeah, so we do cross collaboration all the time. Very rarely are we, at least for the projects that I've been, have we been siloed to create these things. And like I said, whenever we can bring in professionals like the translating, even though I am a native Spanish speaker, I still really value these professional transcription and translation services. And so we make sure that there's budget and money to help cover those kinds of things and those costs. And then let me think, what else have we done? We actually are again, because we're expanding, we're hiring a communications person who's going to be joining our team. So that was a big need, and we're really excited. We're in the process right now of interviewing folks that have these amazing communication backgrounds and marketing. So I'm really looking forward to that resource as well. Heidi?
Yeah, Tamara, that's such a good question and an important thing for all of us to keep in mind. So on the research project side of things that I'm on, obviously, you all know, we're limited in budget and time, almost always, with few exceptions, but we still do try to involve large multidisciplinary teams that do have expertise in all these different pieces. I think our main go-to, and I'm not saying it's the only way, should include more experts in other fields, but is our main go-to is going to the communities and asking them to review. But yes, understanding from the design piece, the communications piece, that is certainly something that I feel like our center is lacking in. So I'm also really excited that we're able to hire someone who knows this. And I just posted, I just posted, oh, there it is. It's just up in the chat. healthexperiencesUSA.org. That's one initiative that I'm in. It's called the methodologies, DIMPAC's International and our local organization for, not local, the United States organization called the Health Experiences Research Network. It's solely focused on communicating health experiences of patients using the patient voice in a lot of different ways. And we've also done a lot of research, not just on what their experiences are, but how this platform works for people of all different levels and backgrounds, and whether it's for education purposes or just learning for your own self-interest. So there are a lot of resources on that website as well. Just to show the research behind the communication and the effects of the communication that we do in health experiences. Also, we run a training. There's one in the spring. If you're interested in learning about it, you can shoot me an email. For sure, we'd be
Heidi,
happy
can
to
you
share
repeat?
some.
You just said there's training in the spring, but that part kind of broke up. Can you repeat that,
Yeah.
please?
Let me just put this in chat. So after I'm done talking, we go to the next question or topic. I'll put in my contact information because I actually run that training, Health Experiences Research Network, and the methodology behind it. And it's a virtual training, but hosted by the University of New Mexico and reasonably priced. I think it's under $400, but I highly recommend it as a method, as a way for communicating patient health experience. I'm just looking at chat. So yes, for sure. I'm happy to share examples of our flyers.
I think the question in the chat that you may be reading right now is from Ashley Carlson. And she's just talking about how much communications has changed in the world of AI, literally in the past year. And if you are navigating or leveraging these changes, and how are you doing that at CACTI?
I am not doing good at leveraging AI. Part of me is afraid. Part of me just wants to keep using my own brain. But then there's also, apart from the research side of things, we are still not allowed to use AI, our institution. We can't use it for any health data or research data, even if it's not protected health information. But from the communication side of things, we are allowed to use some AI, and I know Cynthia does use it way more than I do.
Yeah, I use it for our community engagement newsletter. I do this thing that I call word vomit, where I have an idea and I'm just writing everything that I want to go into this section of our newsletter. And then I'll be like, oh gosh, this is ugly. And I'll stick it into ChatGPT and ask it to condense it for me. And I have been really happy with the results of how it condenses it. And it'll even ask me, do you want me to make this more concise, even more? And I'll be like, yes, please, like reduce words. And it still is so great. So in a newsletter, again, we're not doing private health information and not data, but it's just this conversational thing. So I've used it in that way.
Ashley, did that answer your question? I don't even know if she's still on. She might be gone. I just had a question about your newsletter again, and congratulations on starting that. Who is your audience for the newsletter? I'm just curious. We have a bulletin, and I don't call it a newsletter intentionally because there are no articles. There's no, you know, it is literally a regurgitation of a bulletin board. It's just a bulletin board in an electronic format and not a newsletter. So I'm curious because I always want to expand and we're always doing continuous improvement. And so I don't know if I'd even be able to pinpoint my audience of the bulletin. But for you, I'm just curious because, I like to copy all the stuff that you do, Cynthia. So.
Yes, so our newsletter is completely community facing. So again, here in New Mexico, we're fortunate that our state supports these county groups called health councils. And this is where we do a lot of our networking, our study promotions, um, our presentations, because all of these people within each county come together in this context of health. And so each county, of course, looks different. And so, there's politicians that attend these health councils, clinicians, doctors, people who are just volunteers who just care about their community. There's faith-based organizations. So it's really just an amalgamation of all these people and communities. And so when we attend these health councils, we'll tell them we have a newsletter. If you want to get on our newsletter list, please give us your email. And so we send this out. We have about 600 people who have asked to be on our newsletter list, which is really great. And then we've had like faculty around the university that are also like, I know I'm not technically a community member, but we like seeing what you're putting out, what you're doing. So please add us. So I'm happy to add anyone. Sharayla, if you want to receive our newsletter, I'm happy to share with you also so you can see an example of what we're doing, what we're putting out. And again, like I will be a communications person soon. But I just find so much joy in doing this kind of stuff. I really do. But I know I don't want to like overburden everyone either with all this information. So we decided a quarterly newsletter fit like what we needed to do. And so that's what we've been doing and just we were in an indigenous pueblo called Acoma, which is about an hour and a half away from Albuquerque. And we were doing a presentation there just last month. And someone from this elderly, cute woman came up to me afterwards and was like, I remember seeing your picture. I get your newsletter, and I recognize you right away from your newsletter. So it does reach out to people, which is really exciting.
Thank you. I'll email you. So just to, in case people aren't following in the chat, I just wanted to follow up. Ashley's audio visual isn't cooperating with her today. But just so here at KU Medical Center, and I'm curious for our UMKC folks, what do you use? But we have a enterprise licensed co-pilot. We obviously don't use it for sensitive information, but it has been a tool for creating graphics, taking an Excel document and making it into something that is more aesthetically pleasing, reading knowledge. There's a lot of potential there, but Ashley did say, and I wholeheartedly agree, human intelligence is essential to that. And Heidi responded with, they are allowed to use Copilot as well at CACTI. And even though she hasn't done much with it, all the things that she's read says the human brain is still essential to make sure it makes sense and fits the context. At UMKC, do you have a co-pilot type or an AI platform that you use?
Alex, do you want to answer that one?
The only platform I know that we're working on is ChatGPT in terms of doing multiple licenses with each of the schools, and it's project dependent. But that's the extent of my knowledge.
And so when you say project dependent, does that mean they have to get approval before they use it with any projects, or is it just open and available for the different schools?
I think individual faculty can have licenses. And what's happening is this, like the medical school just bought a number of licenses for our faculty after being suggested that we pursue that course from the School of Engineering. So the School of Engineering is way out ahead in this space.
Yeah, the School of Engineering, we had a meeting on AI, and they actually have journals that are AI journals and AI conferences where everyone is using AI unabashedly. So there are these different attitudes, and to Melinda Liz's point, there are lots of environmental implications. So my children, for example, shudder at the thought of using AI because they know how much water and energy it uses, and it's not worth it, Mom. And so it's really interesting to hear different perspectives on it. So I'm glad we're not just assuming that this is what we need to use. We need to be critical in the way that we think about it.
Sounds like we need a conversation around AI at a future MARG meeting, huh?
Definitely.
Well, we are running. Oh, keep going.
Well, look at Ashley's wonderful point. Bias is a big topic that we talk about. The School of Humanities and Social Sciences, they're the ones that are carrying the torch for that one and saying, hey, folks, it is absolutely not quote unquote objective. Not that we really believe anything is, but let's point that out and be very critical about it. So yes, Shirela, wholeheartedly, let's do an AI panel and talk about the different ways that it's useful, that it is a tool, but we need to think about the ethical implications of it.
Absolutely. Thank you again, Cynthia and Heidi. I know how early it is, Pacific Standard Time. And so you agreeing to even do this at our 9 a.m. meeting means so much to me. I appreciate you. I will disseminate their slides to the group so that you can click all the links that are in those slides and click to your heart's content. And you already have Heidi's email that's in the chat if you would like to contact her. And I will contact you, Heidi, about your spring not conference. I can't think of the word. Yeah, Thank you, the training.
Sorry,
so that I can.
A long time for the mute.
Well, I couldn't think of the word. So I will make sure that I pass that on in the spring to all of our people here at Frontiers as well, since it is open across the country and it's virtual. Thank you all so much for attending. I did miss one announcement, is that our the Frontiers Research Symposium will take place March 12th. It is a Thursday, and we will be at Children's Mercy Research Institute that day. So please, you can go to our website to register if you're interested right now. We are accepting poster presentations as well. So those of you who work with our young investigators or our students, please encourage them. We do print the posters for you. So that is all, that shouldn't be a barrier for anyone that's interested in presenting their research at our symposium. So again, thank you all so much, and we will see you next month in November. All right, take care, everyone.